Good morning, everybody. This is Carla Saenz again. I'm the Regional Bioethics Advisor at the Knowledge Management, Bioethics and Research Department of the Pan American Health Organization, which is the regional office for the Americas of the World Health Organization. Before I continue, I would like to invite you to let me know if you to tell me if you hear me. So if you can hear me, please go to your chat and give me a smiley face. So if you can hear me, give me a smiley face. There we go. Okay. So now we know you can hear me, and we'll continue. Welcome to the webinar series on research ethics for the Caribbean that has been organized by the Pan American Health Organization, CARFA, and BSEC. Everybody, I think, knows CARFA. BSEC is the Bioethics Society for the English-speaking Caribbean. I'm very happy to welcome you from very cold Washington, D.C., which probably looks very different from your current location. We will not be using the camera in this series because we want to ensure that everybody has the sufficient connectivity to go through the session. But I want to say hi to you all, and this first webinar serves as an introduction to this series, which, as I said, is a joint effort between all three organizations. I want to thank CARFA and BSEC for teaming up with PAHO in this initiative, and I want to especially recognize Edwin Bolastic, who is here with me right now from the PAHO office in Trinidad, whom we owe the effort of putting this initiative together. As I said, this is the first webinar of the series. I want to share, before I start the presentation, I want to share the schedule with you. So we'll have two general sessions on general introductory research ethics topics, and I'll be in charge of those. And then we'll have 4 sessions to discuss specific cases on research ethics. Those sessions will be in charge of Derek Aarons from CARFA and Cheryl McPherson and Grace Duryucharan from BSEC. So these 4 last sessions are focused on the discussion of research ethics cases. These research ethics cases come from WHO's casebook on ethical issues in international health research. You can see the cover of the book there, and this is a book that's freely available, and you can access it if you go to the website of PAHO's regional program on bioethics. That's www.paho.org/bioethics. You'll find on the right tab the recent publications and the link to the casebook. This casebook is a WHO publications, and it was edited by Richard Cash and others, and has been translated into Spanish by PAHO. So why are we doing this? Why are we we're providing research ethics training as part of this joint effort, but we're making a point about using this casebook and focusing on the case discussion after these 2 general introductory sessions, because we aimed at strengthening the skills for ethics analysis. We want to focus on the applications of principles of research ethics to actual research ethics cases. We think that in this effort, we can also show a different way to teach bioethics to all of those of you who are involved in any type of ethics training, but also to those of you that are part of research ethics committees and that are seeking a way to train all your members. So as I showed in the previous slide, today we'll be talking about research ethics, about its importance and history. We'll have a presentation on the topic, but we also want to make sure that there's time at the end to have a discussion about these topics. I will, this introductory presentation is divided in 2 sessions. The next one is next Wednesday. And the specific issues of what makes research with human subjects ethical will be discussed in the next session. So in this session, the goal is to provide you with a framework for research ethics in terms of its importance and the history of research ethics. And so I also aim at framing, providing a framework, a system framework for the ethics review of research ethics, of research with human subjects that many of you are familiar with. In order to talk about the importance of research ethics, I think that our starting point should be the importance of health research. We usually take health research for granted, but it's health research which has made possible all the improvements in health and well-being that we currently enjoy. If we live now till the age of 70 plus as a rule, it's because health research has been done. If a number of conditions that were not curable many years ago now can be cured, it's because we've conducted relevant health research. I mean, in the last 15 years, for example, child leukemia has gone from being a disease that would kill the majority of children to a condition that can be cured in more than 90% of the cases. And that is because of health research. So as I said, we take health research for granted, and there are very few occasions in which you are reminded about how important health research is. The one that comes to my mind, and probably to your mind too, is Ebola. Ebola would have taken an absolutely different path if we had completed research on mechanisms for effective treatment. Ebola was a terrible, it continues to be a very sad event in our history because we don't have an effective treatment to provide to the persons that contract Ebola. So, as I said, research ethics is first of all important because research is important. And when we think about research and the way health research is conducted, we have to keep in mind that research is not just an activity of researchers, of health researchers. It's not just something that investigators and their teams do. Research is possible, because there are many altruistic research participants. Research with human subjects is a subset of all health research, and a very important one of them if we think about translating research to actual practice, so it actually has an impact on our health and well-being. But research with human subjects can only be done if there are research participants, if people volunteer to be part on research studies. So given that there are many people that from whose generosity we benefit every single time, we have the duty of ensuring that those people are treated ethically. So how do we ensure that people that participate in research are treated ethically? What does ethical treatment of research participants entail? And furthermore, what are all the set of protections that we owe to all research participants? What else can we do to ensure the research is conducted ethically, that the whole apparatus of research is conducted ethically? And I think this question is very important. How do we catalyze ethical research that improves the health and well-being of population? It's not that ethics is against research. Our duty as research ethicists is to catalyze the research that is ethical, research that brings the improvements in health and well-being that we all enjoy. That's the task of research ethics. It's not to forbid research, but to ensure that research ethics is done ethically. Research ethics, as you all know, is a rather young discipline. And it's a discipline that has resulted from a series of scandals. Unfortunately, history shows that research participants have been treated unethically in a number of circumstances. And so the history of research ethics is a history of scandals. Many of you may have heard about the Nazi experiments conducted during the Nazi regime in Germany, about Tuskegee here in Alabama in the U.S., and about the recently discovered unethical research conducted in Guatemala in the 1940s. Those are not the only instances of unethical research, but they provide very unfortunately good examples for different types of moral wrongs. When there's a problem, an ethical problem in research, it's not always the exact same wrong. I think the Nazi experiments are prominent because research was conducted without the consent of those participants. They did not have a chance to decide whether they wanted to be part of research of those studies or not. In Tuskegee, research participants were deliberately denied an effective treatment, which led to severe health problems and ultimately death of many of them. In Guatemala, the persons that were part of these studies were intentionally passed a disease like syphilis that killed many of them. So they were deliberately infected with syphilis. As you can see, there's a very wide set of moral wrongs. There are very different moral wrongs that each of these cases imply. I don't want to talk today about the specific historical events or about the specific series of international documents that resulted from all of these events. I want to take a more general approach with you today and talk about the general learning process that has resulted from this history of research scandals that constitutes the history of research ethics now. And I want to focus on two specific key elements of this learning process. First, I think we've learned to go throughout the history of research ethics from exclusion to inclusion, although I do think that this is a lesson we're still struggling with. The second lesson, I think, is that we've learned to go from general rules and principles to more nuanced and specific guidance for ethics review of specific research cases. So I'm going to say more about each of these main lessons that I think capture the learning process of research ethics. First of all, we have learned that to protect research participants is not merely to exclude them from the opportunity to participate in research. And I think that if I had to summarize in one sentence what's the transition between the Code of Nuremberg to the Declaration of Helsinki, which the Code of Nuremberg is from the 40s, the Declaration of Helsinki is originally from, I think, 63, and the last revision is from October 2013. But the main reason to move away from the Code of Nuremberg to embrace the Declaration of Helsinki is that the Code of Nuremberg indicated that research was only acceptable if informed consent from the participant was going to be provided. So it excluded all of those that could not consent on their own. That means that, for example, children that cannot provide consent on their own were automatically excluded from research. The Declaration of Helsinki was developed in order to fill this weakness of the Code of Nuremberg and wants to accommodate the inclusion of research participants even if they cannot consent on their own, while ensuring that those participants are given the appropriate protections to ensure that their participation in research is ethical. So we went from excluding all those that we wanted to protect in order to include participants and ensuring appropriate protections. And of course the question is, what are those appropriate protections? How do we protect research participants? To protect research participants, it's not as simple as merely excluding them. I think this is a very current discussion that we still have with respect to vulnerable populations. I would love to be in person with you and do a show of hands, but I would like for you to think about how many of the medications, how many of the drugs that we regularly give to children have never been tested, have never been studied on children. It's about 70%. More than 70% of the medication, of the drugs that we regularly give to our children have never been tested on children. I doubt that any of you would think that this is good for children, that children are better off because they were excluded from studies, from research studies. I think that children would be better off if we would know what is it that we were giving them, if we had done appropriate research on the medications that we give them. So in order to protect children, our initial intuition was to exclude them from research. And it turns out that the exclusion led to a situation that's worse off for children. Now we give them a series of drugs and it's without a protocol. And parents as a rule assume that physicians know whether those drugs that are being prescribed to their children work or not, or safe or whatever, but it's merely implied. So they don't even get the standard protections that we would that they would be provided with in a research setting. Something similar has happened with pregnant women. With a very intuitively correct will to protect them, we've taken the path to exclude them from research. So we thought pregnant women are in a vulnerable situation. Let's protect them. In order to protect them, let's exclude them from research. But that has led to a similar situation in which children find themselves in, because it turns out that pregnant women, sick women get pregnant, and pregnant women get sick. So we are often in the need to provide pregnant women with medical treatment, and since we have not included them in research studies, we don't know how to do it. So we are, an attempt to protect them led them to a worse situation for pregnant women. So we know now that excluding people from research merely, often increases their vulnerability. But that presents us with the task of including them, but making sure that they're treated ethically, that sufficient protections are provided. So how is that done? And that leads me precisely to the second lesson learned in the history of research ethics. We need thorough ethics review. So at the beginning, research ethics was more like a series of prohibitions. That's more like the Code of Nuremberg. Don't include anybody that cannot provide consent on their own. But we've moved away from such a system, such a way of understanding research ethics, to seeing that an ethics review of every single research protocol that involves persons is necessary. This was a crucial contribution of the Declaration of Helsinki, requiring that all research with human subjects is reviewed by an independent ethics committee prior to the initiation of the study. And when we talk about an ethics review of an independent ethics committee, we have to clarify that ethics review stands for a genuine analysis of each research protocol, taking the particular context into account. A research protocol conducted in Sweden might be very different from the same research protocol, might post that with very different ethical challenges that if that same research protocol would start in rural Africa, for example. One of the key elements of ethics review committee, and we'll talk about more in a second, is that ethics review committee must be independent. Why is that the case? Why should ethics review be conducted by an independent body that is not as opposed to by the investigator himself or herself? And it's because those that are conducting the study, the investigators, have something at stake. They want to conduct the research. So that means that they're not well positioned to assess themselves if their protocol is ethical or not. Most likely they don't think it is ethical, and it's not necessarily because they're ill-intentioned. They're so involved in the project that they don't have the appropriate distance to analyze it. Also, an independent ethics review is necessary because it's not enough to claim that to pass a job to research participants on the basis that they will, provide consent to participate or not, so that they, as if they would determine themselves whether the research protocol is ethically acceptable or not. Informed consent, as important as it is, we know now that it's only one ethical criterion among many. Informed consent is not sufficient to determine whether a research study is ethical or not. We can imagine participants agreeing to participate in research that has an exorbitant, that is very dangerous, that has even a negative balance of risk over benefits. That would not be ethical, regardless of whether participants provide research or not. And we can think about examples in history, like the yellow fever studies. Consent was provided, but that wasn't enough. So it's important that ethics review is provided by an independent committee. And when I talk about ethics review, I think it should be important that ethics review is the analysis of the specific protocol at stake, and it's not merely a checklist, going through a checklist for compliance. So one of the fundamental lessons for today's session is that research ethics, is not compliance. If the job of an ethics review committee would be just to check for compliance with certain rules, there would be absolutely no reason for a committee, as opposed to just one single person, to conduct a review. A single person going over the checklist would be as good. Why is it the case that we claim that it's not one single person, but a committee reviewing a protocol? It's because ethics is not compliance. It's because we have to do a deliberation, an analysis of every single protocol. And a group of persons is better than one single person at doing that, which is not the case if we think about just going over the checklist. So I think it's very important to put ethics review into context. Ethics review is an absolutely crucial element of a research ethics system. Ethics review cannot be replaced by a regulation, by any regulation, or by any set of very ethical researchers. But, as important as it is, we have to see that it's impossible for ethics review to accomplish everything that is necessary in a system, in a national system that ensures that research is done ethically. As important as it is, it's only an element of a system. And what do I have in mind when I talk about research ethics systems? So if you think about the setting, the institution in which you conduct research, In order for research to be conducted ethically, a number of pieces are necessary. So you need, for example, efficient and independent, well-trained ethics review committees that are committed to making a very thorough analysis, research ethics evaluation of each protocol. But that on its own is not enough. We also need a normative and regulatory framework for research with human subjects. We need a framework, we need a set of rules that, while general, while they cannot dictate, no regulation can dictate what you do in any possible cases, in every possible case. But no ethics review of research can replace some regulatory framework either. It should not be just the job of ethics review committees to take care of all the ethical aspects of a research protocol. Another element of a research ethics system is are the investigators. We have to ensure that all the investigators receive some basic research ethics training. It's not that all investigators need to be research ethics experts, of course not. Not even all members of ethics review committees need to be research ethics trained experts. They need to be well-trained in the conduction of ethical review. Similarly, investigators should know the basics of research ethics. They should know how to conduct research ethically. They will not take care of the entire institution of research ethics on their own, because their training, as solid as it is, it's one element of a system. But the system, a research ethics system, also requires some effective oversight. Someone with authority that will be able to check what happens if something goes wrong. And oversight, it does not include only the elements of, it's not limited to the aspect of research ethics, only the aspect of ethics of human subject research, but should include also the matters of responsible conduct of research that are separate from ethics of human subject research. And they apply to all the other areas of research for which we do not do an ethics review. Research ethics systems also include clinical trials registration. So we need, which is ethically justified. If we do an ethics analysis, and say we do a clinical trial, and the clinical trial, and we claim that clinical trial is ethical because of some reasonable risk-benefit ratio, but then we do the same study 10 times. So with 10 times the same amount of research participants, that means we're multiplying the risks by 10, but we're not getting any more benefits. So clinical trial registration is fundamental in order to know what else is being done, whether the study has been conducted already, and perhaps there are even results that show that it was riskier than anticipated, and that we should not do any similar study again. So research ethics systems really necessitate clinical trial registration. Furthermore, in accordance with the last revision of the Declaration of Helsinki, we should not be just registering, making publicly available all clinical trials that are being conducted, but all research with human subjects that is being conducted. Because it's not the case that only clinical trials are risky. All human subject research is risky, yet perhaps for different reasons. I think it's fundamental that research ethics systems include some sort of mechanisms for support, because none of this, for example, as well-trained as research ethics can be, sometimes they'll encounter questions that they don't know how to answer. So we should be thinking about some sort of consult service for research ethics matters. So when one has a question, there's somewhere to go to get more experts involved and learn about how others have handled this issue. This is by no means an exhaustive list, but my point of sharing this with you is to put into context ethics review as a crucial piece, as a crucial element of a research ethics system. And so we're all aware that there are elements, there are key research ethics elements that no ethics review will be able to take care of. I also want to share some lessons that I think we've learned here at PAHO, at the Regional Program of Bioethics, we've learned in the region. I think that as we support each of the countries in the region to strengthen the research ethics system, as we support them in the process of taking care of each of the elements of research ethics systems, we have learned that we're often trying to make one element of the system do the work of all the other elements, or even the entire system. For example, many of the countries in the region are producing or revising the regulations for research with human subjects. But what we experience is that often when national teams are working on regulations, they act as if regulations would replace ethics review. And ethics review cannot be replaced. No regulation can possibly dictate how to conduct every research protocol. Think about the breadth of research studies. Think about all the different types of studies, all the different possible risk-benefit profiles. It's absolutely impossible to, write in one regulation how to handle all of them. While regulations are crucial, they should be supplemented in every single case with a thorough ethics review. And sometimes it happens that we're working on regulations as if no ethics review would take place. So I think it's crucial that when we work on each of the elements of a research ethics system, we keep in mind that there are other elements doing other specific work. So bottom line, we have to do good ethics review. Good ethics review cannot be replaced by anything. And as I said, when I talk about good ethics review, we talk about ethical deliberation and analysis. And I want to share with you too, why is it that we're doing this training activity? Why is it that we are organized this webinar in this way? We have worked at PAHO, we have worked with a number of people involved in research ethics training in the region, and we've conducted an evaluation of our training needs. And we've come to the conclusion that ethics analysis, ethical deliberation and analysis, is the weakest part of the research ethics training in our region, which is why we specifically want to strengthen ethical deliberation and analysis with this series of webinars. So that's why we're making a point about focusing on cases, analyzing specific cases, because we've learned that sometimes we're very good about the theory. We can list the principles. We know the rules, and then we're presented with a research ethics protocol, and we go like, uh-oh, how do we go from those to practice? I'll provide in the next session, next Wednesday, I'll provide some general guideline to approach research ethics protocols and to do ethics review of research. But it's general because we need to evaluate each specific case, and we need to strengthen our skills to do that. So additionally, and this is to recap what I said in the previous in the discussion of previous slides, we need to strengthen all elements of research ethics systems. I see colleagues joining from the Ministries of Health. I see colleagues joining from CARFA, and I think that I hope that this discussion is an opportunity for all of us to think, how do we work within a research ethics view, research ethics systems view in each of our settings. Before finishing the presentation, I want to share with you a research ethics online training that was developed by the World Health Organization with PAHO's contribution. So this training was adapted by the ESOC Center at Oxford University, so it's useful for a wider audience. The training was developed initially for WHO staff. The course is available online for free. A certificate is issued at the end, and you can find it at the Oxford University's Global Health Reviewers platform, and I included the link there. And what I'm going to go ahead and do right now is I'm going to copy that same link and put it and share it with you in the chat, so you can access it if it turns out that you're interested. So having shared this resource with you, I just want to thank you, and I want to start with our discussion. But without getting to that, I'm going to go ahead and put that link for you. I want to invite you to visit the website of PAHO's regional program on bioethics. And if you go to the right tab, you can see our publications, including the casebook that we'll be using for our case discussion in the 4 last sessions of the webinar. And also you can join our mailing lists, ethical research, public health ethics, and bioethics. Thank you very much, and I would like to invite you to please write your questions or comments in the chat, so I can answer them. I'll give it a couple of minutes for you to write it, and then I'll start answering them. Thank you very much. Thanks for joining us in the very first webinar of this series with CARFA and BSIC. I'm also including Edwin Bolastic's email there for those of you who are signing up for certificates for this activity, and if you want to get more information about the previous about the upcoming sessions. So I'll give you some more time while you're working on writing your comments or questions, and I think I will leave the screen on the schedule. Okay. Comment from Dr. Agatha Carrington. This series of webinars will strengthen the work of our ethics committee at the University of Trinidad and Tobago. Thank you, Dr. Carrington. Indeed, I want to share with you that we're doing a similar series of webinars in Spanish in cooperation with the Latin American Forum for Research Ethics series, and we have a number of committees registered as such. So many committees in the region, for example, the Ethics Review Committee at the University Cayetano Heredia in Peru, is using this series of webinars as part of the yearly training of their ethics of their members. And some other committees, some other countries, for example, like Colombia, and this is an initiative led by CDEIN, a research institution based in Cali, are reproducing a similar series at the national level. So that allows them. It's also a very good way of strengthening the national network for research ethics. I'm waiting for more comment. Please email the schedule of the webinars to us and advice on how to apply for the certificates of continuing education. This is a comment from Karen Lewis Bell. You can get you can email Edwin Bolastic his email I copied in the chat a moment ago, belasty@paho.org, for the information about the certificates, and I will share with you in a second the link with the information about the schedule. The schedule is there, and I'll send you. I'll copy the link in a second. Derek Aarons, or dear Derek from CARFA. Thanks, Derek. He would like to advise participants. Would like us to advise participants that the session was recorded and will be available at the PAHO website for future reference. Indeed, yes, we will share this, and I think what we can do with all the sessions is record them and include the PowerPoints, the PowerPoint slides, the recording, and we can make a little list with some resources like the casebook itself, the lists for research ethics networks, and the casebook. And the course, the course that's available at the WHO developed course on research ethics. So you have like a little toolkit that that can help you. And if you have specific suggestions for how to advance research ethics training, please don't hesitate to email us. Similarly, if there are specific topics for future research ethics webinars that are of particular interest in the Caribbean, we would greatly appreciate it if you would share them with us, so we can make sure we focus on them, focus future activities on them. How will you advise persons or organizations, this is a question from Catherine Innes, who have not engaged in formulating an ethics committee or in establishing one? We're happy to support that process. There is fantastic work conducted by our colleagues on BSEC, and I'm sure Derek or Cheryl can share that resource with you on how to establish a research ethics committee in the Caribbean. At WHO, we have a publication that I will share with you on the operating procedures that, how should ethics review committees operate. So, oops, I noticed that while I'm doing this that it's not a on our website, but I'm going to copy it. It's a publication by WHO on I'm going to read on the guidance on operating. I'm trying to retranslating to Spanish. Hold on, that one, no, the little one on top. Yes, sorry, I don't have the English version handy. It's on the guidance on operating guidance for the ethics revision of health research. I'm going to share the link to the document with you. And one of the reasons why this document I think is very useful, and I think your question is very relevant, is because we see that sometimes we're all trying to, as it were, like reinvent the wheel, as opposed to taking advantage of resources that are there. While ethics review committees can have slightly different ways of proceeding, they're very there are rules that apply to all of them. So I included the link to the document that addresses those specific practical issues, operating issues that ethics committees should take into account. The document is entitled Standards and Operational Guidance for Ethics Review of Health-Related Research with Human Participants. And yes, thanks, Dr. Carrington. This is PAHO has a book which is called Ethics Review Committee Standard Operating Procedures for Submitting Research Proposals. Yes, this link to the publication that I share with you is a revision of what used to be called the Silver Book that I think has helped many ethics review committees in the region. And but going back to one aspect of your question, Catherine, that does not get answered by this document, is that I think it's very important that that we take into account that in order to conduct meaningful ethics review, we have to ensure that we research ethics training is provided to all the members of the committee. No committee will do a good job if members don't know how to do research ethics review. And so in my experience, sometimes institutions rush into establishing the committee and don't take a moment to ensure that the committee has the reasonable expertise to conduct that job. So we are lucky training initiatives are can be conducted in collaboration with a number of partners that are very involved with in the region, and I'm talking, of course, about CARF and BSEC. And I want to also indicate that there, at this point, there are in the Caribbean new opportunities for research ethics training, and Dr. Cheryl McPherson from BSEC is in charge of a fantastic initiative that is funded by Fogarty, by the National Institutes of Health, to provide research ethics training in the Caribbean. Cheryl, if you can, if there's a link that you can share with our colleagues in the room about the initiative, I think they would greatly appreciate it. A final comment about the work of the ethics review committees, about how their procedures, is that at PAHO, and here I'm sharing another link with you, at PAHO we have developed a software for ethics review of human subjects research. And of course, it's not that the software will do the review, but it's a tool to facilitate the work of the committees. It's a tool to do so the submission is done electronically. So the committees have a series of some help when they conduct the review. So they can monitor not just the process that starts with the submission to the approval of research protocols, but also what happens after a proposal is approved. So it also the tool also involves the monitoring of approved research by the committee. And it's integrated with the clinical trial registration. So I was, before starting the session, I was discussing with my colleague, Dr. Bolastic, about sharing with our colleagues in the Caribbean this tool, ProESOS, because I think it's very useful for ethics review, given that we all know that one of the fundamental problems for conducting meaningful ethics review is that the majority of committees operate with very limited resources and have, as a rule, really no tool for the management of the research ethics process. ProESOS aims at supporting the management, facilitating the management of ethics review, but it has embedded tools that aim at ensuring standards in ethics review of ethical research. So we'll be happy to organize a session just to share that with you. In the meantime, I want to share Derek Aaron's from CARFA comment that applications for the training initiative at St. George University led by Dr. Cheryl McPherson have to be made each January, and 12 candidates will be admitted for the online certificate course in research ethics being done through St. George University in Grenada, where Dr. Cheryl McPherson is based. The first cohort, 12 candidates, has been selected, and there we go. Sorry, it's sometimes hard to read all this. 12 participants will start in April, and you're all invited to apply for the second cohort of this training course in 2016. The resources will be and information will be make available online, and I strongly encourage you to sign up on our site, on our research ethics site, because we will make that information, we will share that information with all of those that are registered, of course, on top of every other mechanism for dissemination that of BSEC and CARFA. Okay, well, I'm just gonna wait I'm gonna share the link to the list and to your ethical research list, and even if the name is in Spanish, all the information goes in English too. And if there are not any more comments or questions, we would be ending this session. I'm just gonna wait for 30 more seconds if anyone has a comment to add. And where can we access the case discussion information? The case book. If you go to the website of PAHO's regional program on bioethics, you will see that on the right side, on the right tab, there's an entry to that says new bioethics publications, and there you will be able to access the casebook, and along with other tools that we have there, for example, the guidance on ethics of tuberculosis prevention, care, and control, and the ethical considerations in developing a public health response to pandemic influenza. These other two resources that I've shared with you are mostly pieces of public health ethics, although there are they have some sections on research matters. So I'll go ahead and share with you the specific site of the, oh, you found it. Fantastic. Here we go anyways for those of you that haven't. Okay, well, thank you very much. I would love to be with you in person in all your locations. I'm sure it's warmer than here in Washington, D.C. And I look forward to our next session in a week. Thank you very much and have a wonderful day. Bye.